Another area of the spine that we commonly see patients having problems with is the lumbar spine. Most frequently, patients come in with herniated or bulging discs in the L4-5, L5, S1 discs. These areas are carrying the entire weight of your body, and so they're most susceptible to being injured. There's another factor that goes into this in addition to injuries. You see, what happens is the lumbar spine and the pelvis function together as a unit, even though they're anatomically two different areas of the spine. The lumbar spine and the pelvis functionally work together. Essentially, the pelvis controls 80% of bending and moving in the lower back area. The lumbar spine is supposed to take care of about 20% of the movement. Now, the control of the pelvis is governed by the muscles in your legs that attach to the pelvis. So these muscles are the front of your legs, which is called the quadriceps, the back of your legs, which is called the hamstrings, the sides, which is called the gluteus muscles, and then the inner thighs, which is called the adductor muscles. These muscles control the movement of the pelvis. If these muscles are tight, what they end up doing is locking the pelvis in place. Now, where the pelvis is designed to perform 80% of the movement, but it's all locked up, it now can only perform 50% of the movement, as an example. And so, despite the fact that it's only doing 50%, that's not a problem for the pelvis because it was designed to do 80% of the movement. However, people are still bending over, tying their shoes, picking things up off of the floor. So if we've lost 30% of the movement, how is that possible? Well, here's where the problem comes in. The lumbar spine begins to make up for that movement. And as an example now, if the lumbar spine picks up the extra 30% that the pelvis is not performing, the lumbar spine is now taking on 50% of the biomechanical movement. And so it was only designed to do 20%. And so what happens now is the discs begin to get beat up as a result of that. They're carrying more of the load than they were designed to do. This is where arthritis and bulging and herniated discs and spinal stenosis come from. What is basically happening is the mechanics have been driven from the pelvis up into the spine, and now we're beating up in the lumbar spine. In order to fix that situation, what most people do is they just have surgery and have the bulging disc, which is being inflamed and causing the problems, they have that bulging disc go under surgery and remove it. Now that's all well and good, and maybe the pain goes away for a while, but then it has been shown that if the mechanics aren't taken care of, now the pressure goes up into the spine and the person bulges and herniates the next level of disc, and then they have the same problem over again. The difference that MUA offers is by stretching out all of these muscles, reducing the scar tissue, we can actually drive the mechanics from the lumbar spine back down into the pelvis, restoring the 80-20 relationship, taking the pressure out of the lumbar spine. Once the pressure's out of the spine, then the bulging and herniated discs are no longer susceptible to becoming inflamed. And so MUA is an absolutely phenomenal technique for quickly restoring the mechanics back into the pelvis. When that happens quickly, the response to care is quick as well. This is not something that takes 2, 3, 4, 5 months to get better. The patient begins to feel better within just 2 to 3 visits. And that is a huge advantage that MUA offers over anything else that's out there. In addition to these problems in the spine and pelvis, we get pain radiating into the hip area. People are constantly complaining, my hip, there's something wrong with my hip. Well, just the same way as the shoulder can be affected by the neck, the hip can be affected by the lumbar spine. And so patients very often are complaining of pain in the hip, pain in the knee, pain in the foot, whether it's actual pain or it's referred pain, numbness and tingling being caused by irritated nerves, or it's just muscles that have gone into spasm relating to those areas, throwing off the mechanics. Again, you can rehab these, and very often that works well. But once you have gone under an MUA, again, the purpose of the MUA is to make sure that we can stretch out these tissues without you feeling any pain or apprehension at all. The ability to get 2 to 3 months of care done in 2 to 3 days is what occurs. And so patients have results actually very, very quickly. And because we have dealt with the root cause of the problem instead of the symptom, the results are long lasting and they are not temporary.